Hello, beautiful people. This is Steffi B, and I'm here to study with you guys. And today's topic is pharmacology. So we're going to go ahead and we're going to do 10 questions today of things that we need to know. All right, let's get started. Number 1. A client arrives at the clinic complaining of fatigue, lack of energy, constipation, and depression. Hypothyroidism is diagnosed, and levothyroxine is prescribed. What is an expected outcome of the medication? 1. Alleviates depression. 2. Increases energy levels. 3. Increases blood glucose levels. Or 4. Achieves normal thyroid hormone levels. What do you guys think? The answer here is number 4, achieves normal thyroid hormone levels. Why? Let's go back to the question. The question is asking us if a client comes in, they have hypothyroidism, and they're on levothyroxine, what is an expected outcome of this medication? If we look at our answers, we see symptoms of that medication, but we're looking for a goal. What is the goal of this medication? If they're on a medication to increase their thyroid level and increase their symptoms and increase their energy level and increase their blood glucose, the goal of this medication is to achieve a normal hormone level, right? We don't want it to be too high or too low. We want to make sure that it's just right? Right in the middle. All right, moving on. Number 2, a 56-year-old adult client with heart failure is receiving digoxin. The nurse is auscultating the apical heart rate before giving digoxin and notes that the heart rate is 48 beats per minute. Which action would the nurse take? Here, the answer is number 3. Withhold the digoxin and assess for signs of decreased cardiac output and digoxin toxicity. Why? Let's go back to the question. Let's see what the question is asking us. It's asking us, we have a patient, we took their heart rate's 48, should we give them digoxin? What should we do? Rule of thumb is before giving digoxin, we check their heart rate and we have to see if it's over 60. If it's under 60, we don't give digoxin. So right away, if you read this question, you see it's under 60, you hold it. You do not want to give it, because if you give digoxin, it can lower your heart rate even more, and you don't want that patient to bottom out. This patient has a heart rate of 48, right? So it would make sense to assess for signs of decreased cardiac output, right? So if they have bradycardia and the blood is pumping slow through their body, you want to check their peripheral pulses too, right? You want to check their capillary refills. You want to look at their temperature, their skin color. Are they pale? Are they cool? How's it looking over here, right? You want to take their blood pressure. You want to assess for cardiac output. But the first thing is you want to go in there and you want to check their heart rate before giving digoxin. All right, let's move on. Number 3, a client who has been taking high doses of acetylsalicylic acid to relieve pain from osteoarthritis now has more generalized joint pain and an elevated temperature. The nurse would assess for which complication to determine whether the client has other signs of aspirin toxicity. 1. Diarrhea. 2. Constipation. 3. Double vision. Or 4. Ringing in the ears. The answer here is number 4. Ringing in the ears, tinnitus. So why is that the answer? So let's go back to the question. So what is the question asking us? So it's asking us to look for a complication for aspirin. A client has aspirin toxicity, what would we expect? So they would have ringing in the ears, they would have tinnitus. So also too, it will stimulate our respiratory system. So they will be breathing fast, they will hyperventilate, right? And it also stimulates our heating production. So we will have a fever too. So we cannot have more than 4 grams of aspirin. 4 grams. Number 4, The nurse is providing instructions to a client with seizures who will be taking phenytoin. Which statement, if made by the client, would indicate an understanding of the information about this medication? Number 1, I need to perform good oral hygiene, including flossing and brushing my teeth. 2, I would try to avoid alcohol, but if I'm not able to, I can drink alcohol in moderation. 3, I need to take my medication before coming to the lab to have my blood level drawn. 4, I need to monitor for side effects and adjust my medication dose depending on how severe the side effects are. What do you guys think? And the answer is number 1. I need to perform good oral hygiene, including flossing and brushing my teeth. So why is that the answer? Let's go back to the question. The question is telling us there's a client that has seizures, they're prescribed phenytoin. What statement by the client would tell us that they understand this medication? With this medication, it has an adverse effect of gingival hyperplasia. What is that? So it's overgrowth of the tissues, right? Here in your gums. So we want to practice good oral hygiene. So we want to floss, we want to brush our teeth. That is very important with that medication. All right, so let's look at the other options. So number 2, we want to avoid alcohol. We don't want to take it in moderation. Number 3, when we go and get blood levels on this medication, we want to make sure we do not take this medication right before a lab because it can alter the results. Okay, and the last one, number 4, we don't want to play doctor. We don't want to adjust our medication dose based off of the side effects. If we have side effects that are very concerning, we want to contact the doctor. We don't want to play doctor. All right, moving on. Number 5. The nurse has administered a dose of meperidine hydrochloride to a client with renal calculi as treatment for pain. The nurse carefully monitors this client for which side and adverse effect of this medication. 1, bradycardia, 2, hypertension, 3, urinary retention, or 4, increased respirations. The answer here is number 3, urinary retention. Why? Let's go back to the question. So what is the question asking us? It's telling us the client is on meperidine hydrochloride for pain, right? So what side effects, adverse effects are we looking for with this medication? With this medication, it is a opioid analgesic, right? So everything is going to be suppressed. So let's look at the other options. Number 1, they would have tachycardia, right? So their heart's going to be racing. Their heart is going to be trying to work because everything is going to be going down. So they're going to be having hypotension, orthostatic hypotension. Number 4, they would have decreased shallow respirations, right? And number 3, urinary retention or constipation, right? So our bowel sounds will be hypoactive. The GI system is going slow, right? So for this question, we want to look at the medication and the side effects of this medication. So the answer here is number 3, urinary retention. Moving on. Number 6. The nurse is administering a dose of triamterene to a client with heart failure. What is the most significant adverse effect of this medication for which the client would be monitored? 1, edema, 2, bradycardia, 3, hypertension, or 4, hyperkalemia. The answer here is number 4, hyperkalemia. Why? Let's go back to the question. So what is the question asking us? So it's telling us first that there's a patient, they're on a dose of triamterene and they have heart failure. So what is an adverse effect that we need to know about this medication? With this medication, it's a potassium sparing diuretic, right? So they have heart failure, they have a lot of fluid in their body, they need a diuretic to remove the fluid, but it's potassium sparing. So it's keeping the potassium in their body and removing the fluid. So we want to watch their potassium level and make sure it's not above 5, right? So their potassium level is usually 3.5 to 5. We also want to be cautious with any potassium supplements, any salt substitutes, because that has a high level of potassium. We want to be cautious too if they're taking an angiotensin converting inhibitor, right? An ACE inhibitor that increases potassium. So these are all the things that we want to keep in mind. Pop quiz. What is another potassium sparing diuretic? Spironolactone. I think I said it right. Spironolactone. Spironolactone. Moving on. Number 7. Before giving the client the initial dose of disulfiram, what would the psychiatric home health nurse determine? 1, if there is a history of hyperthyroidism. 2, when the last full meal was consumed. 3, if there was a history of diabetes insipidus. Or 4, when the last alcoholic drink was consumed. Here, the answer is number 4, when the last alcoholic drink was consumed. Why? Let's go back to the question. So the question is telling us there's a client and he has an initial dose of disulfiram. So what would we look for? With this medication, disulfiram, the way that I think about it is it starts with the D, disulfiram, D for drinking. So this medication is given to clients that have chronic alcoholism. So we want to assess and make sure that they haven't had an alcohol beverage within the last 12 hours. So that's why it's important for us to ask when the last alcohol beverage was consumed. If we look at the other answers, number 1, so we would look for a history of hypothyroidism. So an underactive thyroid would actually make the condition worse, right? So if they drank, they would get even more sick, right? So we do not want that. So that's something that we ask. Number 2, when was the last full meal? It's really not relevant. We care more about the alcohol because if they drink alcohol on this medicine, they will get sick. Number 3, history of diabetes insipidus. No, it's diabetes mellitus. Big difference, right? So diabetes mellitus has everything to do with the pancreas, right? It doesn't produce enough insulin to control the blood sugar. Diabetes insipidus has everything to do with the kidneys and it produces a whole lot of urine. They are 2 different conditions. All right, moving on. Number 8. A client with AFib is receiving a continuous heparin infusion at 1,000 units per hour. The nurse determines that the client is receiving the therapeutic effect based on which results? Number 1, PT of 12.5 seconds. Number 2, activated PTT of 60 seconds. Number 3, activated PTT of 28 seconds. Or number 4, activated PTT longer than 120 seconds. What do we think? The answer here is number 2, a PTT of 60 seconds. Why? Okay, so let's go back to the question. The question is telling us that a client came in with AFib, they're on heparin. What lab do we look at to tell if it's therapeutic or not? So if we look at the options, one option is PT and the other options are PTT labs. With heparin, we look at PTT labs. A good way to remember this is if you put the 2 T's together, it looks like H for heparin. PT is for warfarin or Coumadin. All right, so these labs, what they do is they tell us how long it takes for our blood to clot. So when a patient comes in and they have AFib, that means that their heart isn't really pushing out blood in their atrium, right? So the blood is gonna pool, which means that it's at a higher risk for clotting. So we wanna put them on an anticoagulant, right? So a blood thinner. So we put them on heparin. We wanna make sure that they are in a therapeutic range. So we have to make sure that it's 1.5 to 2.5 times the normal range, which is 30 to 40 seconds. So here the answer would be 60 seconds. And also too, so PT, that is the lab that you will look at if the patient is on warfarin or Coumadin, right? That's another blood thinner, another anticoagulant. So also too, if they're on a blood thinner, right, a good thing to know is the antidotes, right? For Coumadin and warfarin, it would be vitamin K. That's the antidote. With heparin, if the levels are too high and not therapeutic, and the PTT range is like a whole lot of seconds over the therapeutic range, we want to give them an antidote right now. So we would give them protamine sulfate, right? All right, I think we covered a lot. Moving on. Number 9. A client with history of heart failure who is receiving digoxin daily has a serum potassium level of 3 and is complaining of anorexia. The primary healthcare provider orders a serum digoxin level to be done. The nurse checks the results and would expect to note which level that is outside the therapeutic range. Is it 1.5, 2.8, 3, 1.6, or 4, 2.2? The answer here is number 4, 2.2. Why? Let's go back to the question. So what is the question asking us? That's the first thing I try to ask myself. So the nurse is checking for results. So what level is outside the therapeutic range of digoxin? What is the normal range of digoxin? 0.5 to 2. So if it's above 2, they're not in a therapeutic range and they're in digoxin toxicity. Also too, this client is complaining of anorexia. So that's showing hypokalemia, which is potassium below 3.5. If a patient has hypokalemia, they're at a higher risk for digoxin toxicity. Number 10, last question. The nurse is monitoring a client who's taking propranolol. Which assessment finding indicates a potential adverse complication associated with this medication? 1, the development of complaints of insomnia. 2, the development of audible expiratory wheezes. 3, a baseline blood pressure of 150/80, followed by a blood pressure of 138/72 after 2 doses of the medication. Or 4, a baseline resting heart rate of 88 beats per minute, followed by a resting heart rate of 72 beats per minute after 2 doses of the medication. The answer is number 2, the development of audible expiratory wheezes. Why? Let's go back to the question. So the question is asking us, so which assessment finding indicates a potential complication of propranolol? With this medication, it will decrease our blood pressure. It will decrease our heart rate, right? So if we look at the other options, number 1, a side effect is insomnia. So that is something we do want to monitor. Number 3, that's what we want. We wanted to decrease the blood pressure. Number 4, we wanted to decrease the heart rate. Number 2, we do not want audible expiratory wheezes. We do not want bronchospasms. That is an adverse effect of this medication. So if this client is experiencing expiratory wheezes, we need to know that. All right, we are all done. Thank you guys for studying with me and for being here. You guys did an awesome job. And I heard the best way to learn is by listening. And that's how I learn. I try to listen a whole lot. I am a woman of a few words. I think I said that right. A woman of few words. But guys, let me know what you think, how you feel. Leave it down below. Like the video if you like it. And guys, we'll do this together. You don't have to do this alone. All right. So best of luck. Stay focused. Take care of yourself. And I'll see you guys soon. Bye, beautiful people.